Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, open angle glaucoma. First, risk factors of open angle glaucoma. What are the risk factors of open angle glaucoma? A patient with open angle glaucoma might present with hereditary age, like it is more commonly seen in elderly. It is seen in myopes, diabetes, hypertension. It is seen in patients with cigarette smoking and thyrotoxicosis. So, because of all these features, there is actually decreased outflow from the See, actually, what can happen in open angle glaucoma is because of all these, there will be thickening and sclerosis of the trabeculae will occur. Along with that, there is absence of giant vacuoles in the cells of the Schlemm's canal is also noted. But actually, because of the thickening of the trabeculae, there is decreased outflow of the aqueous humor because aqueous humor will mainly drain through the trabecular meshwork, but now there is decreased output of the aqueous humor, thus resulting in raised intraocular pressure. Here the angle is normal, so it is called as open angle glaucoma.
thank you and thank you for watching.